in.
Hey, good morning, Miss Jewel. How you doing?
Doing pretty good.
Oh, glad to hear it. You're feeling good for your annual exam?
Sure, let's get this over with.
All right, great. My name is Meg. I'm going to be your nurse today.
Okay.
Can you verify your name and date of birth for me?
It is Jill Jewel, 42170.
And do you have any allergies?
Yes, to Augmentin.
Okay, sounds good. Well, we'll just make sure that's recorded in your chart.
Okay.
I'm just going to ask you a few questions to help assess your mental status. So you told me your name already. What day is it?
It is a Thursday.
And where are we?
We are at the doctor's office.
Okay, and what are we doing here?
We're going to make sure I'm all good by a physical.
Okay, and who's the president?
Biden.
Yeah, still, yeah,
Yeah.
that's where we still are. Okay, I'm gonna put some gloves on. Is it okay if I touch your head and your hair?
Yeah, I'll just take my glasses off for you.
If you feel pain at any point, let me know.
Okay.
And do you have any special concerns that I need to pay attention to today?
No, I'm hoping all this is good.
All right, get you in and out. So I'm just gonna look at your scalp and your hair first.
Okay.
So I'm just looking for even distribution, any sores or lesions. Do you have any pain or have noticed any any open wounds?
No.
Okay, good deal. You got pretty even distribution of hair, and I'll just palpate on your head a little bit. Any pain?
No.
Okay. Well, I've got my gloves on. I'm gonna do a couple more assessments where I touch you. So I'm just gonna touch your ears here. And this little part, it's called the tragus. Any issues with your hearing?
No.
Okay, and I'll touch your lymph nodes. So these are the preauricular lymph nodes. I'm just going to gently palpate them. Palpate your postauricular lymph nodes. Any pain or soreness?
No.
And your submental lymph nodes. And no swelling that you've noticed.
No.
Okay. Can you take your hands on your cheeks and pull down your eyelids?
Mm-hmm.
All right. And you've got red, you can close them up, conjunctiva, and white sclera, which is what we want to see.
Okay.
I'm just going to look at your pupils. So first, just looking at them, they're both equal and round. I'm going to shine a light in them. You can kind of like put your focus on my forehead. You don't have to look straight at the
Okay.
light. So I'm just going to look at your left eye first. Okay, and I'll do the light again and look at the opposite side. Okay, that pupil is reactive to light. And we'll look at this other one. Now I'm just going to have you look at the tip of my pen as it comes towards your face. Okay, and pupils are equal, round, reactive to light, and accommodation. I'm going to have you continue to follow the tip of my pen so I can assess the 8 cardinal fields of gaze. I'm going to do a little convenient H shape. Just follow it. There you go. Thank you. Okay, not observing any unusual nystagmus. She's able to follow the pen without any difficulty. Now, can you take your hand and close up one of your nostrils and breathe through one side? And then do it on the other side as well. Any issues with your sense of smell? Okay, can you tip your chin back? I'm just going to look up your nose. Oh, looks clear. And then go ahead and open your mouth. Stick out your tongue for me. Put it side to side. I'm going to look at your gums and your lips. Any issues with your teeth or gums?
Nah.
Nothing out of the ordinary. You seeing a dentist regularly?
No.
Okay. Go ahead. If you could do that for me and then say, like I'm a traditional doctor. Thank you. Good deal. All right. And coming back, if you can press your head against my hand. Good. And just use your neck, not your whole body. There you go, and lift up your shoulders. Good. And then I'm going to assess your carotid arteries. I'm going to do those pulses one at a time so that I don't make you pass out. Okay. All right, and those are strong, equal, and regular.
Good.
I'm going to come down and do the pulses on your arms while I'm doing pulses. So I'm going to do your brachial arteries. Those are strong, equal, and regular as well. And then your radial arteries. Great. All strong, equal, and regular. Can you squeeze my fingers? All right, good. Equal grips, strength. And no impaired sensation in your arms. Okay, I'm just gonna, is it okay if I squeeze your
Yeah.
shoulders? All right. Let me know any pain or tenderness. And I don't feel any swelling. No pain or tenderness?
No.
Okay. And then I'm gonna look at your fingers and do your cap refill. And that's a brisk, that's 2 seconds or less. And I don't observe any clubbing, any pain in your fingers or hands. Okay. All right, I'll go ahead and start listening to you.
Okay.
So I would inspect her chest and her breathing for equal chest rise. I don't see any retractions, any pain with breathing, any shortness of breath.
No.
Okay. All right, I'll go ahead and listen to your breathing now. So I'll have you take 1 breath per location, but we don't have to go fast. You don't need to hyperventilate or anything. So take slow deep breaths out of your mouth. Just around the sides. And in a patient care setting, I would need to listen underneath the clothing.
Okay.
I'm just gonna come around and listen at your back, sorry.
No, I can
I
move.
couldn't reach you. Do that one more time on this side, I wasn't quite ready, thanks. I would also want to visualize the patient's skin and make sure there are no lesions. Do you noticed any open sores, anything of concern on your back?
No.
Okay. I'm gonna go ahead and listen to your heart so you can breathe normally now. So
Okay.
I'm gonna listen to the aortic valve first, here on the right side of the sternal border. Okay, I'll listen to the pulmonic valve. I'll listen to Erb's point. Come down and listen to the mitral valve. And oh no, I missed tricuspid. I'm sorry.
Oh,
Yeah,
tricuspid.
so-
Aortic, pulmonic, Erb's point, tricuspid, mitral. Sorry, students.
And then-
So this is mitral over here. Tricuspid was the previous. Okay, I'm hearing normal S1 and S2. I don't hear any skips, bumps, or rubs. Have you been experiencing any kind of chest pain?
No.
Okay, great. So if you don't mind, I'd like for you to lay down and you can listen to your stomach. Have you had any issues with your bowel movements?
Not this week.
All right, that's good news. And when was your last one?
Yesterday.
Okay, is that a normal pattern for you?
Yeah, I'm not an everyday person.
Some people aren't. And then any issues voiding your bladder or peeing?
No.
Okay, good deal. And again, I would inspect your stomach, any bloating, discolorations, bruising, any pulsations.
Nothing that I've noticed.
Good. And like I said, I would look at the skin and see what it looked like in a patient care setting. So I'm gonna go ahead and listen to bowel sounds. I'm gonna start in the lower right quadrant. Turn my scope around again. All right. You must be hungry.
It's talking.
Ready for lunch?
Yes.
All right, I'm gonna listen with the bell and listen to the abdominal arteries.
Okay.
First, I'm gonna come up here below the xiphoid process and listen to the abdominal aorta. no bruise, just those bowel sounds. Then I'm gonna come around the back, place some pressure and listen to, you're fine, to the renal arteries bilaterally. And the iliac arteries. No bruise auscultated. Good. All right. I'm gonna feel on your belly. Let me know if you have any pain or tenderness.
Okay.
Just say. Abdomen is soft, non-distended. I don't press too hard on your bladder. While we'll have you down, I'm just gonna feel on your hips, knees, and
Yeah,
ankles. Is that
sure.
okay? Thank you. Any pain or tenderness? Any issues?
No, it just tickles.
I would palpate the femoral arteries. I do it in here on me. It's midway between the hip and the groin, and they should be strong and equal bilaterally. So I would look at the skin of the legs and look at the hair distribution, any discoloration, sores or lesions or bruises. Any problems with your legs?
No.
No, not really. Maybe. All right, so let's feel those pedal pulses. I would also, if there's no polish on the nails, I would check cap refill in the toes. Make sure that there was no discoloration, lesions, or dry and flaking skin can be a sign of impaired circulation. So I'm gonna move your feet around, is that okay?
Yeah.
So do some passive range of motion. Okay, can you press down onto my hands and lift up onto them? Okay, so a strength 4 out of 5, which is normal. I'm just gonna lift up your knee towards your chest. Check the range of motion of that knee, and I'll do arms when I stitch you back up. Any pain?
No.
Okay. Bring legs out to the side, look at the hips. Okay. So can you do those independently? Can you flex your feet, roll them around in a circle? Bring your knees up to your chest one at a time. Good. Very good. And then out to the side one at a time. And kick them up one at a time. Nice. All right. Great. No pain, no issues?
No.
All right. So let me have you swing your feet around and sit back up. I'm gonna go ahead and test your reflexes. So just let your foot swing. There you go. There you go. So you can let them swing, let them swing. There we go. Just wanna make sure that your feet are nice and relaxed, because if you're kind of moving your muscles, the reflexes aren't gonna work as well. Yeah. No. You're little stiff
I'm
legs
not
over
moving.
here. You gotta relax them.
Gotta make them like noodles.
Yeah, make them like
Make 'em
noodles.
like noodles.
There you go. No. Doesn't want to.
I don't have good.
No.
I'll tell you that.
No. Okay. Well, hopefully you would have reflexes. All right, so let's just do some range of motion on your arms. I'm just gonna start moving your arms for you. Okay. Here. And to the side. Okay. Other side. Here's up. And then up. All right. And then can you do that independently? Roll your wrists around and pull your arms up to your shoulders. Good. And then up over your head as far as you can go, but not painful. Any issues, any pain?
No.
All right. Anything that I missed? Anything that I missed?
Not that I can think of.
Hopefully not. They'll let us know.
They will let us know.
Well, thanks for being such a good patient to me. You
No
look
problem.
awesome. Keep taking good care of yourself. And I will just clean my hands and get that charted for you.
Okay. Thank you.
All right. You're welcome. Have a good day.